Hello, I'm Elizabeth Hill-Karbowski, Vice President of the Women and Family Service Line at Ascension, Wisconsin. Before we begin the last in our four-part series with MkeMoms, I wanted to take a moment to say thank you for spending time with us, for viewing these videos, and for sharing them. I would also like to say thank you to Sarah for the arrangement of this series. Whether you saw messages regarding COVID, healthcare, pregnancy, women's health, self-care, or how to take care of those that you love during this time, we hope that you found these messages to be informative and meaningful. Ascension, Wisconsin has a long legacy of providing care that is exceptional, personalized, and compassionate to the patients, families, and communities that we serve. Throughout southeastern Wisconsin, you'll find many Ascension physicians, advanced practice nurses, healthcare teams, and hospitals. The hospitals that we have in southeastern Wisconsin include All Saints in Racine, St. Francis, Elmbrook Hospital, St. Joseph's Hospital, also known as a baby hospital, Columbia St. Mary's Ozaki, and Columbia St. Mary's Milwaukee, where we are currently celebrating the recent opening of a brand new state-of-the-art labor and delivery department. Ascension has taken numerous measures to make certain that the healthcare experience, whether inpatient or outpatient during this time, remains patient-centered and safe, proactively addressing the needs of this time, including those of social distancing. We invite you to make an appointment with one of our talented physicians, advanced practice nurses, or healthcare teams. For those of you who prefer telemedicine, those remain an option as well. As time goes on, you may find that guidelines and recommendations regarding COVID may change. Again, if you have any questions, we invite you to give us a call. In the meantime, we look forward to the privilege to minister to the needs of you and your family. And now, please join us for the last of our four-part series highlighting Dr. Kate Roberts.
All right, welcome everybody to another video in our Ascension Healthcare series where we are discussing women's health during the time of COVID-19. Just for the sake of establishing where we are in the timeline, we're recording this video now several days into what, I know we keep using the term the new normal, and we've kind of used that along the way here, but it is, we've gone from living our lives as we know it to lockdown. We're under a pandemic to this kind of strange transitional time where we're not in safer at home anymore, but we're also trying to figure out what it looks like and what it means to navigate a world where the virus is still around, but we're also trying to navigate back into a new sense of life as we know it. And today we're talking to Dr. Roberts from Ascension, Wisconsin, and she's joining us talking about a couple of these questions that we have yet to cover and a few things that we want to get to know about her. So thank you again for taking a few minutes to chat with us, Dr. Roberts. Let us know a little bit about you.
Sure. Well, thank you for having me. This is a great organization. I'm a big fan. So my name is Kate Roberts. I'm one of the general OBGYNs at Ascension here in Milwaukee. I grew up originally in Iowa. I grew up in Cedar Falls, Iowa, and then stayed there for school throughout the process. I went to undergrad at Luther College, where I studied biology and psychology. And then I did medical school at the University of Iowa. And then I went to Chicago for residency at Advocate Illinois Masonic Medical Center. And then after Chicago, I wanted not quite as big of a city, but so that's when I came here to Milwaukee. So I am here now. I am in my first year here in Wisconsin, but so far loving it. Want to be here forever now.
We get a lot of Chicago transplants that are like, Chicago's fun, but
it's a mini
I think there's something better north. Yeah.
Yes.
we get a lot of that. As a Badger alum, I'm like, ooh, Iowa, how was that? But
I know. I have a lot of patients that mention that, but you can keep it in the Big Ten here.
Yeah. Hey, respect. I mean, like that football, we have our jump around, but y'all have the turn around and wave at the children's hospital. So I can't even throw shade.
Yeah.
Like that's really amazing.
Hospital be built. So that's my claim to fame of how I can always be loyal.
Oh, that's cool. That's really cool.
Yeah.
So out of what offices do you currently practice then in the Milwaukee area, and then where do you deliver babies?
Sure. So I have actually two office sites. I am at Glendale on an office on Northport Washington Road, just south of Hampton Avenue. And I am there most days of the week. And then one day a week, I actually am in the office at St. Joe's Hospital, which is where I do all my deliveries and all my surgeries for gynecology needs and things like that. So it's
Gotcha.
really helpful to have kind of two sites. So women who live either closer to St. Joe's or have a big loyalty to St. Joe's Hospital can get in and kind of get all of their stuff done at one site. It's really
Yeah.
helpful.
Yeah, and it's such a central location, and there's a lot of public transportation and things like that that can get you there.
Yeah.
Anything unique about your practice that you want to highlight at all?
So I'm one of the general OBGYNs. So I'm able to really see anyone. I always say when people start to think about, do I need a gynecologist? It's probably time to go see the gynecologist. From that time on, throughout a woman's life, I'm able to really see in the office, and we can take care of any kind of obstetric or gynecology or just women's health question or need that arises, whether it's just yearly checkups or trying to get pregnant or their prenatal care or any problem that comes up. At both of those office sites, we're able to do high-risk obstetrics. We do a lot of that with St. Joseph. We're able to, since we have access to our maternal fetal medicine specialists there, at what we call the perinatal assessment center. There's a great NICU there. It's a level 3 NICU, so they're able to really care for a lot of babies that are born early or born with other high risk going on. And we also are able to do a lot of our in-office procedures, which can save some women a trip to the operating room with some of these. So we can do what we call colposcopies or LEEP procedures, which we do for abnormal pap smears, or hysteroscopy, which is a very fancy name for just a minimally invasive procedure where we basically can put a camera inside a uterus to kind of see what's going on, if there's any issues going on. And that
I had no idea.
Surgery. So that's something that not every office is able to do, but we do have the ability to do that at both of those office sites.
Yeah, with that in mind, that just raises a question for me that we get asked quite often, actually, in our private Facebook group for MkeMom. People are always, when they're looking for a new OBGYN, it's a little like dating, because like you gotta like shave your legs, and go and get and like talk about some intimate stuff. But like if somebody is looking for a new OBGYN, whether they've switched healthcare systems through their employer or moved here for whatever reason, I'm looking for an OBGYN, what would be some of the recommendations that you would give to a woman, like questions to ask, or where to start? Where do I even start? Because it's an overwhelming process.
It is. And especially in the field of OBGYN, people are talking about things that they don't talk about with anyone else a lot of times in life, for better or worse on that, but there's a lot of stigma around some of those things. And so it takes a lot of women years to be able to even mention some of their questions or problems to a gynecologist that they've seen. Embarrassing or for whatever reason.
Well, you have to use words like discharge,
Right, exactly.
Who wants to use words like discharge in a conversation? Nobody does.
Exactly. Or something very personal, of if they had a miscarriage or they're scared that they're having a miscarriage because they had one in the past or something like that, besides maybe their partner or something like that. So what I would say is there's a couple of things. One, when you first meet them, listen to your gut. And, if you click with that person, I think that's great. And you can really develop in a relationship with that person. If you don't really click right away, there's a lot. You can find another one that is within, the same system that can help you keep all of your records together, and get you to the hospital that you want to go to, and a convenient clinic location, and everything like that. So that's one thing. And then another is I actually love it when patients ask me why I went into this, because I think that really lets us dive into what our goals are kind of out of their care or their appointment, whether it's just here for my annual checkup. I know I need my mammogram and no issues. I'll see you in a year, but it lets us get to know each other. And that's the door, with any kind of doctor that you have, it should be a kind of a relationship where you understand what they're trying to do. I understand what your goals are out of the appointment and everything like that. And particularly in the world of OBGYN, it's a little bit more of an intimate relationship. And, I could give someone the best news of their life. I could also give them the worst news of their life. And so someone just be comfortable with where you're going.
Yeah, that's good advice. Thank you for that. Like, I know that was kind of like a curveball that I threw at you, but
no worries.
we get that question so often. So it's really helpful to hear that. So, okay. So turning to navigating this in the time of COVID-19. It's been said before, but I think it bears saying again, folks should not be skipping appointments just because of this, right? Like, there are precautions in place. There are things being done to make sure that we can get taken care of safely. Correct?
Yes, absolutely. Do not skip your appointments. You can call your doctor's office and see either what specific safety measures they have in place, because that is changing really week by week and even day by day right now as things start kind of go to this new normal. But it's also, there are some instances where we might say, you know what, we actually don't need you to come into the office for this. We can do this over the phone or over a video appointment. That is an option that we can do. So we can get you to where you're getting the care, you're getting assessed, you're not putting something off, but we're doing it in the safest way possible for you.
Yeah, definitely. When it comes to everything else that's going on in life, like, are there precautions that you're recommending to patients that they're taking now, like incorporating into the routines that are more important than others? Like thinking of things like, wearing a face mask, hand sanitizer, avoiding certain places. What are you suggesting to patients right now?
So I really am suggesting to patients to wear a mask outside of the office now too, anytime they go out into public, and making sure that that mask is covering their mouth and their nose. A lot of times you'll see someone wear a mask, but it's down around their chin. That just doesn't really help you out. So wearing that in really all the public places that you go to, whether that's the grocery store or the gas station, or now if you decide to go to more of the public places that are open, or people are going back to work and your job allows it, wear it as much as you can at work. It's been said since this whole thing started, but good hand hygiene is so important. So washing your hands, but washing them well for a full 20 seconds is just so important. So I really try to tell patients, as soon as you get home, wash your hands, even if you felt like you washed them 100 times.
Yeah.
So wash your hands at home before you, interact with anyone else that you're living with at home.
That's one of the biggest things I think I've learned in this whole thing, is that 20 seconds is a whole lot longer than I thought it was.
It really is. It really,
like, geez Louise. Like, I mean, we've always been like, wash your hands after you use the restroom, things like that. But then when it was like, okay, make sure you do 20, the 20 seconds thing kept coming. We started, in our family, we picked a song, like our hand washing song, even though my kids are older, like I had to give them a frame of reference. And like, they were like, are you sure we have to sing this whole verse? I'm like, yeah, you do. And like, even my hands started to get like dry and stuff from it. And I was like, what is wrong with me? How did I not know this?
It's hand sanitizer and lotion that everyone are going through.
Right? So much lotion. Yeah, I have this like right next to me now, like at all times. My like intense hand cream.
Yep.
What is happening? I want to circle back to the face mask thing really quick, because I want to just talk quickly about like maybe some of the basic protocols with these. Like, because now, it's getting easier and easier to get a hold of like homemade fabric masks, or even like the disposable ones. But there are ways that you can use them that kind of negate their effectiveness if you aren't using them correctly. So what's kind of best practices when it comes to wearing the masks as we interact in public places?
Sure. So really it's making sure that it's covering what it should cover. So mouth, nose completely should be covered, and they shouldn't really be loose to the point where if it's you could fit an entire hand inside. That's
Okay.
really covering enough. We certainly, don't want you to feel like you can't breathe and it's so tight where you're, having difficulty.
Yeah.
But it should be comfortable, but kind of snug on your face.
Because the goal is to like stop droplet escaping, correct?
Yeah. It's to kind of decrease the spread of what we all have when we cough, sneeze, talk, yawn, all day-to-day activities, breathe even. So it's just to try to decrease that spread. But another thing too is making sure that you're washing them at home. So wash and dry them. You can rewear them. That's safe as long as they're not getting, soiled with, they fall on the ground or something like that. If they do, then it's time to wash them. But making sure that you're routinely washing them every so often and drying them at home is also really helpful. If you wear the same mask throughout this whole thing, it's only going to help you for so long.
Right. Yeah. I found that for me, it even just helps me not touch my face.
Yes.
It's a face toucher, like
everybody is. You don't even realize it.
Oh my goodness. I think the first week of this, I was even just trying to like do a video just like this. And I was like, what is wrong with me? I can't stop touching my face. But when I have that on, at least I have that physical barrier that's like stopping me from scratching my nose or doing whatever.
Exactly. Yeah. And that's another thing that it helps protect you, in terms of decreasing your spread, it's protecting you, but it's protecting everyone else around you. If it's also preventing you from touching your face, that's something that is directly impacting you and directly protecting you because you can't wash your hands every second of the day.
Yeah. Out of curiosity, has there been any conversation about that you're aware of about time frame, like for how long it's going to be recommended that people wear them as often as possible?
I think there's conversations all over on every kind of government level, nationally, statewide, local. Right now, there's no recommendations. I think that the numbers are just a little too preliminary, and I think people are hesitant to have any kind of number in case that changes because things have changed rapidly, and we went kind of from all to nothing for the majority of people, and now we're trying to kind of slowly go back into this, but we might have to go back to nothing if this doesn't work. So it's a very dynamic process where hopefully we don't have to go back to nothing. But if we do this in a safe way and everyone's on board with it, we're hopeful that we don't have to, but timelines are just not quite there yet. Yeah,
no, that makes sense. Like you said, it's been changing so fast, the new information coming out every day. And I don't envy the swirl. Like it's been overwhelming enough for me, just a normal, random person. For those in the medical field, I can't even imagine what it's been like, probably like drinking from a fire hose every day.
That's a very good analogy.
Yeah. Two more things that I want to make sure that we cover. First of all, if you do have a mom who is pregnant, who has been diagnosed as COVID positive, what are specific considerations that are that she needs to be aware of that with working with her care provider, and especially if she's going to be delivering while COVID positive? Are there any particular insights you can give into that scenario?
Yeah, so it does change the delivery plan a little bit with that. Right now, most hospitals do have visitor restrictions in place where someone who's coming in to have their baby can have someone there with them. Unfortunately, if someone is COVID positive, the safest thing is to decrease that risk as much as possible to everyone around. And so right now, what would happen is the baby team and the team for mom would be present at the delivery, and we would have all the equipment that we need to keep everyone as safe as possible. The baby, as soon as baby's born, the baby teams really do assess that baby and keep baby safe. And we try to keep baby and mom as covered and separated as much as possible because we know exactly what happens to babies that were to get this. And so a lot of times we do, no one wants to hear that, oh, I'm going to do this alone and things like that. And so we have, the coaching section from home on these Zoom calls and everything. But then we also have people who are safe at home that can take care of baby when mom is right now in exposure. It's trying to keep everyone as safe as possible. Now, the good news is that those numbers are significantly decreasing, and a lot of women, when they're pregnant that are being tested, a lot of them are coming back negative. So the hope is that we're able to find anything before you were to deliver. But in that rare case where you are positive on delivery, it does change the plan a little bit for, I know, everyone's ideal birthday party for that baby.
Yeah.
But trying to keep everyone as safe as possible, because we just don't know exactly what happens with babies when they're exposed that young.
Would a COVID positive mom after delivery be able to breastfeed or no?
So it depends a little bit on how mom is doing, because there are some people that test positive that feel totally normal, and there are some that are very, very sick. So there is a little case by case with that. But certainly they could keep pumping so that they keep a supply going.
Is that kind of what you're encouraging at that point, to just limit contact?
And if that's something that mom desires to do, we absolutely can do that. And then hopefully by the time that baby can, come up for those snuggles and to feed down the road, that, there's that supply in and everything.
Yeah. Oh, it breaks my heart to think about it. Like, I understand like why those things would have to be the way that they are, but oh my goodness, it's like that one's a kick to the gut a little bit. It's a hard one.
I completely understand. They're tough deliveries to see.
Yeah.
When people who are delivering right now, they first got pregnant before all this happened. We were still how life was. And so that was
totally.
And on someone's hypothetical, this could happen at some point for me, and how my delivery is going to be. But the goal is to try to keep everyone as safe as possible, and then we can get back to that normal as soon as we can.
Well, and the important point I think you made was that there's just so little data about what this could do to a fresh to this earth newborn, that, taking the risk is, really daunting. And so you want to make sure that you're taking as many precautions as possible, because you literally don't know what could happen. So it's a really tough pill to swallow, but I think most people would understand it. That's where those support systems come into play so strongly.
Yeah, it's been so surprising. Women are so resilient anyways when we're talking about coming in to have a baby. But, in the few cases where we have had to have these deliveries with a COVID positive mom, for the most part, people are very understanding and realize, we all want the same thing. We all want healthy mom. We all want healthy baby. It's how we get.
The goal's the same. Yeah,
exactly.
And last but not least, obviously this particular season has created a unprecedented situation in our economy and then a lot of people's finances. And I know all too well how medical expenses can be extremely financially burdensome, and especially with lost jobs and furloughs and things like that.
Yes.
So in the time of COVID, and even post this, as we're starting to try to, recover, there's a lot of families that are going to be dealing with financial hardship. How might you advise a woman who has been hesitant to come into the clinic for some sort of medical concern because of financial hardship?
Sure. That's a great question. That, a lot of times people don't want to mention that to us when they are coming in, whether it's the stigma that we were talking about, just the intimate of those visits. But I really recommend that people talk to us about that, because we can get you connected to the appropriate people and the appropriate resources to really help you with that. We do want to still see you. We still want to get people into the office and get the care that they really need. And Ascension really feels strongly about seeing everyone regardless of what your financial circumstances are, whether it's in general or because of COVID, because that has significantly impacted a lot of people in terms of finances. And it's a huge stressor for a lot of people right now.
Yes. Yes, it is.
So
It's being felt by a lot of us.
Yeah, tell us what your concerns are, and we can get you hooked up with the right people to really try to ease that burden as much as possible.
Awesome. Okay. Thank you so much, Dr. Roberts. This has been so helpful. And I've said this at the end of every one of these videos, but I want to just say thank you, because I know it's been stressful enough for those of us that have just been like, oh, I'm stuck at home with my children all day. But for those of you that have had to go into the healthcare environment, you know, decked out in PPE, putting it out on the line every single day. Thank you very much for everything that you've been doing the last several weeks to help keep moms and babies safe.
Well, thank you. That's what we're here for. That's, it's the joy of the job is taking care of people when they really need it.
Now I'm gonna cry at the end of this. What the heck?
I don't want
you so.
That's cool.
Well, on that note, thank you.